Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here to Be Your Own Hero. I'm a stage 4 prostate, bone, and lung cancer patient slash survivor, doing very, very well. Here from today is a beautiful day in Texas after we went through quite a bit of cold, but it's all good. And every day is a blessing, and we're all fortunate to be able to open our eyes every morning and experience every single new day. I am so thrilled and so excited to have a really, really special guest. Her name is Peggy Whisner, and I'd like to introduce her to you right now. So, Peggy, please introduce yourself and tell us a little bit about who you are.
Hi, I'm Peggy Whisner, and I'm from Texas. And he's right. We just got through surviving a little cold spell here, so we're ready for it to heat back up. But I was 55 years old when I got diagnosed with cancer, but I am back. I'm a survivor, and I'm ready to roll with life. Cancer changed my life. It changed my outlook, but it was all for the better. I know that may sound a little funny, but it did. Um, it healed my heart in a lot of ways because I
Wow.
forgave people that I had held grudges against. I learned how to forgive them because none of those things are important. Um,
Let,
I
let's
learned.
I'm glad you said that. Let's talk about that. That's something that I experience as well. But yeah, share with us what that meant to you and what you did.
It was a relief to get that off my chest, so to speak. Um, One thing about hearing your diagnosis when they come and tell you you have cancer, it's just like everything stops for a moment and you realize how precious life is. You realize what's truly, truly important in your life. And then the rest of it is just noise, basically. And the things for me that are the most important were my family and my relationship with Christ. Those are the things that matter. Everything else is just stuff or whatever it is. But you have to really value what's important to you because God holds the keys to your life, not you. And so you learn that. Um, and two, that helped me keep going forward.
I love that. What was what were the circumstances that prompted you to forgive people, and how did you go about that? Because I think that for all of us, I think that's a really, really difficult thing.
Well, it did take a lot of prayer on my part because I knew I had been holding some grudges uh, due to some things that had happened in my life. But it was just like, for some reason, as soon as I got my diagnosis, over the next few days, things just started coming out of my heart, and I was able to let it go. And so you talk about feeling better in that respect, that helped me tremendously. And I think that that really helped me develop a better mindset going into treatment and what all that entails as well.
So let's start at the beginning. How did it come about that you got diagnosed? What symptoms were you feeling, and what happened during that time?
Well, what started out for me was I had hemorrhoids and they run in my family. I went to my doctor and got medications and was being treated, and it sort of got better. And then another month went by and wasn't feeling too good. Still wasn't really better in that department. Went back to my doctor, you know, nothing out of the ordinary, just wasn't feeling that good. and he gave me some more medication, but I got to where I couldn't lay on my left side in bed at all. So finally went to the ER, and that's where they found my tumor. My tumor was on my left side behind my rectum. And I had had all my cancer scans, everything had come back clear. Um, and the surgeon told me, you know, your cancer, and with the oncologist, they told me that it wouldn't have been found with the normal cancer scan anyway. So it's just, you know, I just started feeling bad enough that I went to the ER, and they did a CT scan at the ER and found the anomaly on the scan. And after they looked at it and researched it, that's when they diagnosed me with cancer. I had a squamous cell carcinoma, which is the easiest form of cancer for them to treat, and eradicate it usually. So that's how my journey started. I
Well,
was hospital.
let's
Sure.
back up a little bit. No cancer is easy. I mean,
No,
no matter what
no,
kind of cancer it is, whether or not they say it's easy, anybody who has cancer, it's something to be dealt with. So,
exactly. Exactly. Uh, of course, when I got out of the hospital, of course, treatment was aggressive. Um, so I started that almost immediately. They wanted me to get started with radiation first. So I had 6 weeks of radiation. Um, I think that's, yes, it was 6 weeks of radiation and 2 rounds of chemo. And it was aggressive. I mean, I had to go every day for treatment, and it's tiring. You get tired, but um, I had a calendar that I would just mark the days off. Each day I'd get back home from treatment, I would mark that day off my calendar. So that's how I got through radiation treatment. Was that for me, the chemo part of it was, it was not so bad compared to the radiation. For me, radiation was the toughest part of the treatment
why
to go through,
why is that?
because it was, my treatment was in my pelvic area, and I could feel it burning after the treatment. Um, and you get so tender in that area.
Hmm.
And it, after, you know, several weeks of treatment, you're sunburned really good, and it, you just hurt.
Hmm.
So that's what made that really difficult. And I would come home. There was a couple of times I would get back home from treatment, and I would just cry because it hurt.
Hmm.
Um, but you know, it got better. And when that last day of treatment come, I was the first one that day. They let me come early that day to get my treatment completed, and I got to ring that bell saying I was finished. And everybody that was waiting for their treatment, they were so excited when I come around the corner for me. So that was a really good feeling. But I think what helps the most with that is, just like I said, have a calendar and cross those days off as you get treatment. And that way you can see the progress you're making, um, and see how close you're getting to the end of it.
Let's talk. We talked before we started recording here, and you mentioned about your mindset and how your mindset has helped you through this. Uh, so you got your diagnosis. What were your thoughts then, and how did mindset come into the picture for you?
When I got diagnosed, my first reaction to it all was shock. I was like, I'm too busy. This can't be, this can't be right. Um, but as it started to sink in, and me being a um, Christian woman, I, of course, read my devotionals every day. And it was from that mindset started to kick in. And it's like, you know, God's going to help me get through this. He's going to help me get through this. But my mind never went to the fact that this is a terminal illness. It just never went there at all. And deep down inside, like we discussed earlier, Mark, that I just knew there was something more I was supposed to do on this earth and that I wasn't done yet. And I just had too many things going on. So that was my mindset. And it helped me move forward. And then too, as I had mentioned to you previously, I had a tremendous prayer warrior team, and I can't thank those individuals enough. There's people I don't even know that were a part of that. And I just really learned and really realized during all of that how awesome our God is that we serve. He can do amazing things. And I thank him every day, and I'm grateful for every day that I have.
Love it. Absolutely love it. Let's talk about, and I could relate to this as well, how being in sales and the things that you've learned from sales, how it's influenced your cancer journey.
Well, you learn a lot about mindset in that particular field. You have to have the right mindset, because your mindset in everyday life, even if it's not right, it can make or break you. And if you have a go-getter mindset, you're going to get up every day, you're going to get dressed, and you're going to move forward no matter what. And that's the mindset that I have. It's like, I've got things to do. I have to get up. I have to get going. So to me, that's something that you're born with. You can learn it, but I think it's more difficult if you're trying to learn it. But you have to definitely work at it every day. I mean, I do work on my mindset. I read books. And
Which books do you read?
well, there's a book that I've read. Think and Grow Rich is a good one that talks about mindset.
Zig
There's
Ziglar.
another one, Zig Ziglar. He's very good. Um, Failing Forward is a good book as well. And there's just
Who wrote that one?
um I couldn't tell you the author's name right off the top of my head, but I have the book. I just can't remember who wrote it right at the moment.
Anybody out there watching, I highly recommend. He's passed away. It's been several years, but I've actually had the chance to meet Zig Ziglar in person, and I was at probably about a dozen of his live events in the past. And so he is absolutely terrific. All of his material is on video and audio, and it's there is a Zig Ziglar Corporation that you could look up. I would highly recommend it because he was one of the greatest, absolutely phenomenal. And we didn't even discuss this beforehand. I mean, what she said uh, about See You at the Top, we didn't even discuss it, and it happens to be one of my favorite books as well. So yeah, I absolutely agree with you.
Well, and then another, he's number one in the world right now, and that's Ed Milet.
Mhm.
On mindset, and to his book, The Power of One More, and Max Out. I highly recommend those books. So,
And you tie it in with your profession, but it's also very um, together with the cancer journey. You could apply these same principles no matter what you do. But in fact, I think that's where my resilience came from, was all of my years of sales training and things like that, it actually did sink in. So, in fact, my old boss came from Irving, Texas. So I have a great affinity for Texans, even though I just moved here back in October. So
Well, you need to get a cowboy hat now.
I'm working on it. I'm okay with the hat. I'm not sure about the boot yet.
Uh,
So tell us some more about your cancer journey and the things that you experienced through it and what you've learned.
well, I think women going through the type of cancer I have, um, of course, there's certain things that happen to your body during cancer treatment, like what I had, that changes your body and it's going to be changed forever. And sometimes that's not really discussed with you by your oncologist, really, unless you just come right out and ask them. But for women that's on here, if you have questions, go see your gynecologist. They can help you. But there is so much when you go through treatment that it just affects your entire body, it affects your life, it affects everything about you. So I think that your treatment, it has to be well rounded. I mean, I've learned that. Um, and don't be afraid to ask questions. I think that's a big one. I think, we think, well, I'm not going to ask that because they're going to think, I don't know anything, but that's not the case. They want you to ask, and don't be afraid to ask. It doesn't matter what the question is because they're there to get you better and they want to get you better. And so I think that's a big thing that I learned because I just, wasn't used to asking a doctor a whole bunch of questions, because you're not taught to go in there and ask a whole lot of stuff. But going through cancer treatment, you learn that, and you learn to talk about it.
That is a great point because what we always say about a cancer journey is it's your personal journey. It's your cancer journey. It's your cancer battle. And nobody's going to care more about your life than you. And so you have to make it about you, you know.
Right.
Because the medical system is so crowded and there's so many people involved in it, unless you speak up, like you just mentioned, Peggy, unless you speak up, you're just going to be a number. But if you speak up, um, that's how you say, "Hey, I'm a person. I want your help and I want your attention." When I'm in your office, and
Right.
it's a very, very. I was having a discussion with the doctor last night on an interview, and she said that the way she looks at it, and she's a very unique doctor. She's actually in another Texan. She's in Houston, and and she's a very, very compassionate doctor. And the way that she looks at patients is she tries to treat them as a family member, as your child, as your sibling, as your spouse, as your, grandparent or whoever it is. That's the way she treats it, but she's very, very unique. And so in most cases, what you have to do is you have to raise your hand and say, "Hey, I want your attention and I want your help and I want your full knowledge in my situation." Because I think the medical field is so crowded that you just become part of this churning machine. And unless you do speak up, like you just mentioned, uh, they're just going to keep on going with their day because their day is going to be very, very busy. So
Exactly. And I did want to mention I kept a journal and I still write in my journal because I'm in year 3 on my cancer journey. Um, and I write down things. I mean, it doesn't matter what it is. Like at first, it was about how I was feeling and how I was doing, and my thoughts about certain things. But I mean, I think it's been important to my healing process too, because things you may be thinking about, you're just going to keep that bottled up sometimes. And if you have a journal, that's what I started doing. My best friend gave me this journal while I was in the hospital, and I just started writing. You know, if I was there by myself, if no one could be there with me at the time, I would write something in my journal. And then I started having, if they would, I asked my nurses and I asked my doctors too if they wouldn't sign their name in it or anything, but the nurses would sign it, and I've gotten some really sweet inspiration by a couple of nurses that was written in my journal, and that meant a lot. And they told me from the get-go that I was going to beat this, and so um, I would like to go back and thank them for that. So.
Words are so powerful, especially from the right people. So,
Mhm.
I mean, the way we look at the medical profession, I mean, a nurse to say those words that you got it, it just gives you that little bit of extra boost, and it gives you that little bit of extra confidence. So words are, I've learned this through my cancer journey, how powerful words really are. Um, because I remember getting my diagnosis, and I will never forget the words that my oncologist said. She said, you know, your cancer is so bad, I can't cure you. And those words will stay with me forever. But I just use that as a reference point as to where I started from and to where I am now. And so people, especially in the medical profession, they don't realize the power that their words carry. And so you're a great example. I mean, I just love your attitude and the way you've approached it. It's just absolutely beautiful. So
Thank you.
yeah, no, you are a champion. You are my kind of people. I love
Yay.
I love interviewing people that have your mindset, because it's just it doesn't happen every day. And it's something that you've worked on for a long time. And it doesn't matter who you are or where you start, but start today if that's the case. And you could work on yourself. Our minds are like a computer. And so whatever we put in it, or whatever we watch, or whatever we absorb, that becomes who you are. And I just love it. So Peggy, we're coming up on the top of our half hour. What are your final thoughts that you would like to leave people with?
I would say don't give up on yourself. They are finding new ways each and every day to cure different types of cancers. So just look forward. There's hope, and you can do this. You've got this. Um, I mean, that's the best advice I can give, and I'm on your side. I'm rooting for you, 100%.
Awesome. Awesome. I have one last question I have for you. Okay.
Okay.
And we didn't discuss it beforehand, and
Okay.
take a second if you need it. Our world today is so divisive and negative and everything like that. How would you suggest that we make this world a better place for all of us?
Let me think about that for a second. I think the big thing would be to let go of the hate that's out there. Um, I mean, I don't understand where it all comes from, but it doesn't serve any purpose. And then just love each other.
I 100% agree. You said it so well. Thank you so much.
Thank
And
you.
I could tell your passion, the passion in your voice, uh, how much that meant to you. And I totally agree, 100%. Let's, you don't know what that person next to you or walking past you is going through. We're all going through things. We're humans. That's part of life. And if you could reach out to somebody and give them, just smile, say hello. And that's one of the things that I really love about Texas is people are so friendly. And they're so willing to help you, which is not the case in California at all. In fact, we had a big freeze here the past several days. Um, and prior to the freeze on Friday afternoon, uh, our contractor, who's become a friend of ours, uh, we're asking about, hey, what do we do, to prepare for the freeze and all this kind of stuff. And he said, do you have this to cover your faucets outside? No, we're from California. We don't know this stuff. And he goes, no problem. He goes, I'll be down. I'll come over to your house. And he was there within a half an hour. And then he brought one of his friends along with him, who we know, really nice guy, and they took care of us and gave us all this advice. And that's how we make this world a better place, is by helping people who need help, right? And not just ignoring them, and caring and being there for people. So I thank these people and all the people surrounding us here in Texas. It's just been a fantastic experience of meeting some incredible people such as yourself, Peggy. Thank
Thank
you
you.
so
No,
much
you too.
for joining me here at To Be Your Own Hero. It was absolutely fantastic. And thank you, everyone out there, for joining us at To Be Your Own Hero. Please like, subscribe, make a comment in the comment section, and we will see you next week. Have a fantastic week. Thank you, everyone.